Hello, my name is Sarah Branch and I am the Oncology Matron. Welcome to St Luke's. My team and I are all here to support you through your journey. We hope you find this video useful as you are preparing to start your treatment.
Hi, my name is Claudia and I'm one of the chemotherapy sisters here at St Luke's Cancer Centre. We hope this video will explain important information about capecitabine chemotherapy and ease some of the fears you may be feeling right now. We will follow this video up with a phone call in a few days' time to answer any questions you may have. Included in this video are cancer and chemotherapy, what is capecitabine, collecting your tablets, your alert and chemotherapy emergency contact numbers, possible side effects of chemotherapy, and what happens after your first chemotherapy appointment. This video will enable you to learn more about capecitabine and answer some commonly asked questions about this therapy. Firstly, we would like to give you an overview on what cancer is and how chemotherapy works. Cancer cells are abnormal cells that are produced by the body when they lose the signal that controls their reproduction. These cells then start to replicate uncontrollably. Chemotherapy is a systemic treatment. The medication goes into the bloodstream, which then is transported all over the body. It damages cells at different stages of their cycle and stops cells dividing and reproducing. Chemotherapy targets rapidly dividing cells, which are cancer cells. But we also have healthy cells that rapidly divide, and chemotherapy can't distinguish between the two. This is why you may experience side effects. Healthy cells can repair themselves, but cancer cells cannot. If you would like to learn more about the science behind cancer and chemotherapy, simply search "What is Cancer" on the Macmillan website. What is capecitabine? Capecitabine is an oral chemotherapy that comes in tablets that can be swallowed. Capecitabine travels to the stomach, where it is dissolved into the bloodstream and is then carried to the tumour. Prior to starting this treatment, a blood test will be taken to ensure you are not enzyme deficient. This is called a DPD test. We will not be able to proceed with this treatment until we have a result of this test, as your doctor may have to adjust the dose depending on the result. Collecting your tablets. In the upcoming phone conversation with the nurse, we will arrange for you to come and collect your capecitabine tablets. Your capecitabine prescription may be made up of 2 different doses of tablets. Please check the instructions before you start. If you are unsure, call the hotline on 01483 571122. At this visit, a pharmacist will meet you to explain how to take your prescribed dose of chemotherapy. They will also give you some patient information regarding your tablets, a diary and a pack which includes the following: an alert card to keep in your wallet or purse, a mouth care leaflet, a treatment plan, and the chemotherapy information card. This is your details and hospital number on the front of the card. It will also have specific details of your chemotherapy treatment inside, along with common side effects of chemotherapy listed 1 to 5. On the reverse of the card is the number for our oncology treatment hotline. Possible side effects of capecitabine and how to manage them. Diarrhea. If you have an increase of 4 or more stools compared to normal in 24 hours, or diarrhea during the night, or a considerably more active stoma, stop taking the capecitabine tablets and call the oncology treatment hotline via switchboard on 01483 571122 and ask for advice. It is important to drink plenty of fluids, including rehydration sachets. Nausea and vomiting. Chemotherapy can cause you to feel sick. The pharmacist will give you anti-sickness tablets to take home and explain how to take these. It is important that you take these as instructed. If you feel so nauseated you cannot carry out normal tasks, for for example, making yourself a cup of tea or having a shower, please call the Oncology Treatment Hotline and we can advise you accordingly. You do not have to suffer unnecessarily. We do not expect people to be vomiting at home, and so please phone the Oncology Treatment Hotline via the switchboard on 01483 571122 if you are. Please note, if you vomit straight after taking your chemotherapy tablets, do not retake tablets. Leave that dose and go on to your next dose. You may notice taste changes or lose your sense of taste. This will return when you have completed your course of chemotherapy. If you are suffering with nausea and have a metallic taste in your mouth, this can affect your appetite. Try and not let this reduce your oral intake. Find foods you enjoy eating. Be sure to eat food high in calories so your weight does not drop, for example cake, biscuits, etc. We recommend you eat small meals throughout the day by grazing, but if you find you're struggling or noticing a weight loss, we can refer you to the dietitian. We also have a number of patient information leaflets, such as eating with a small appetite. Please inform us at your next appointment and we can give one of these to you. If you are losing weight rapidly, please phone into the Oncology Treatment Hotline via the switchboard on 01483 571122 for advice on how we can get you back on track. Sore mouth. Sometimes chemotherapy can cause you to have a sore mouth and mouth ulcers. As a standard, brush your teeth with a soft bristled toothbrush after every meal so food is not sitting in your mouth. If you use a mouthwash, ensure it doesn't contain alcohol in it, as this can irritate the lining of your mouth. If you develop mouth ulcers, you can use Bonjela and rinse your mouth with salt water multiple times a day. If your mouth is so sore it is affecting your ability to eat or drink, you need to phone through to the Oncology Treatment Hotline for advice. Hand-foot syndrome or palmar-plantar erythema. Capecitabine can cause hand-foot syndrome, which is also called palmar-plantar erythema. This is where it causes red, swollen and pain on the palms of the hand and soles of the feet. Sometimes blisters appear. If you have any of these symptoms, stop taking capecitabine and call the hotline on 01483 571 122. It is advised you moisturise twice daily throughout your treatment. Fever or infections. Chemotherapy can reduce the number of white blood cells in the blood. If you have any of these symptoms, stop taking capecitabine and call the hotline on 01483 571. For example, not seeing a friend who has an infection, or going to a large public venue, for instance, a concert where the public may have an infection that can be passed on to you. It's all about being sensible. Symptoms of an infection can include feeling shivery, a sore throat, a cough, diarrhea, or needing to pass urine often. If at any point you think you may be suffering with any of these symptoms or generally feel unwell, you must take your temperature. You will need to buy a digital thermometer from your nearest pharmacy, or most stores sell them. A normal temperature range is 36 to 37.4 degrees. If you suddenly are feeling unwell, take your temperature. If your temperature is within the normal range, please phone through to the Royal Surrey's main switchboard number on 01483 571122. Please ask the operator to be put through to the Oncology Treatment Hotline. If your temperature is outside this normal range, then please attend your local A&E. This means if your temperature is above 38 degrees or above 37.5 degrees on 2 separate readings taken 1 hour apart. If it is less than 36 degrees, you must attend your local A&E. It is really important you attend A&E straight away with a high temperature, as you may develop neutropenic sepsis. Neutropenic sepsis is when the white blood cells, or the neutrophil count, is very low, and you're not able to fight off the infection, and so you can become unwell very quickly. It is therefore important you do not drive yourself. Ask a relative or a friend to drive you, or phone for an ambulance. Rest assured, the professionals will treat you promptly in order to make you feel better. I will now draw your attention to the alert card, or fast track card, which is titled Information for Accident and Emergency Staff. This card should be kept in your wallet or purse at all times. Show your alert card to A&E reception and any health professionals so they are aware you are on chemotherapy. This card will fast track you through the A&E department. Inside the card, it has the name of the consultant you are under and the name of the chemotherapy you are receiving. In A&E, they will take your bloods, give you fluids and start antibiotics if an infection is suspected. Bruising or bleeding. Chemotherapy can affect your platelets. These are cells in your blood that help clotting. If you are noticing any unexplained bleeding or bruising, please phone through to the oncology treatment hotline. Occasionally, you may also notice a spot of blood when you blow your nose or when you brush your teeth. Do not worry if this occurs. Again, perfectly normal, just make a note and discuss this at your next follow-up appointment with your doctor or nurse. If you develop any bleeding that does not stop within 10 minutes, please either call the oncology treatment hotline or attend your local A&E department. Fatigue. You are likely to feel tired or a dip in your energy levels. Please ensure you get sufficient rest. Chemotherapy can have a cumulative effect, so the more treatment you have, the more tired you may feel. Again, this is perfectly normal and you should not feel anxious about this. It is for you to judge your level of tiredness. If possible, try and undertake some light activity. This has been shown to ease treatment-related fatigue. You may find, though, you are too tired, and so it is important you listen to your body and have sufficient rest. If you are so tired you are unable to carry out normal activities of daily living, for example washing, dressing, preparing a meal, please phone into the hotline. Severe skin reaction. Stevens-Johnson syndrome is a rare side effect, but potentially serious. If you experience a widespread rash, with or without blisters, call the oncology treatment hotline on 01483 571122. Chest pain. Very rarely, capecitabine can cause an angina-like chest pain. If you experience any chest pain or tightness or pain radiating down arms and into your jaw, please stop the tablets immediately and go to your local A&E. Do not restart your capecitabine tablets until instructed by your consultant. Depending on the severity of your side effect, a health professional may advise to not take your chemotherapy tablets for 24 to 48 hours to allow symptoms to resolve. You may be instructed to reintroduce these, and if the symptoms start again, stop immediately and call the oncology treatment hotline. If you have been advised to miss some doses of tablets, please bring them back into the St. Luke's pharmacy. Do not make up for missed doses. If at any time you are concerned about any of these side effects or anything is different to what we have talked through, please contact the oncology treatment hotline on 01483 571 122. This is a 24-hour number, 7 days a week. The oncology treatment hotline is an advice line, so please use it if you are unsure or worried about any side effects of your chemotherapy. If you are advised to attend your local accident and emergency department, please present your alert card to a healthcare professional in A&E. Before your next cycle of capecitabine tablets, you will need a blood test taken. This is to check that your blood cells are at a safe level to have chemotherapy. We prefer you to have your blood test done the day before your next follow-up appointment. You can book to have blood taken here at St. Luke's or arrange at your local hospital. During your follow-up appointment, you'll speak to a doctor or nurse and they will ask how you have been feeling. If you're okay and your blood results are within range, your doctor or nurse will discuss the day and time you come and collect your capecitabine tablets. We have guidelines that we follow to ensure we are giving your chemotherapy safely. If at any point your bloods fall outside these parameters, your treatment may be delayed for a short time. This can be a common occurrence for patients on chemotherapy, and your doctor or nurse will explain this at the time. Please don't be concerned. We hope this video has been useful. You will shortly be receiving a phone call from a chemotherapy nurse at the date and time written on your letter. It may be a good idea to write down any questions or concerns or issues asked during the phone consultation. It is never easy starting chemotherapy, and we as professionals realise how anxious you may be feeling. Rest assured, we will make this journey as smooth and stress-free as possible.